Welcome back to Shall You Proceed podcast. I'm your host, creator extraordinaire, Erlene Mango, aka Elise Main, and I have a really great, interesting, informative show for you today. I have Dr. Tamara Beckford. She is right here locally with me in Texas, Houston area. Thank God, okay? Because I have questions. We've been through the same things. We have ice storms. We have COVID, all those things to talk about. She's board certified emergency physician and attended medical school in Newark, New Jersey, and trained in medicine in Philadelphia. Dr. Beckford is over a decade in practice, working in emergency rooms, treated heart attacks, strokes, gunshot wounds, you name it, she's treated it. And she's been on the front lines right now with COVID-19, which we all know about, we're all living through. I want to welcome Dr. Beckford. Hi, Dr. Beckford.
Hello.
Welcome. Thank you so much for reaching out to be on the show. I really appreciate it. I love when we have professionals. I love when we have experts to talk about things. I have so many questions, or I know people have so many questions, and we're afraid to ask questions, right? And
That's
lately,
right.
we tend to rely on social media for our fact base, which truly has a lot of misinformation, or good info gets lost in translation. But before we get going, I want you to tell everyone a little bit more about you.
Okay, well, thank you for having me on. As we said, I'm Dr. Tamara Beckford, and I'm a board certified emergency medicine doctor. So I was born in Jamaica. My family moved to the United States. I was around 11 years old, a little shy of 12. At that point, we were living in Newark, New Jersey, and which is where I grew up, mostly in New Jersey. Went to medical school there in Newark, and subsequently moved to Philadelphia to do my emergency medicine training. After Philadelphia, I decided that I was tired of the cold and the snow, ironically. So we'll talk about that later. And I moved here to Houston, Texas. So I've been in Texas for, like we said, over 10 years, practicing medicine at some of the larger institutions here in the Houston area. And pandemic hit, and I started, in addition to practicing emergency medicine, I actually started my own business, which is a telemedicine urgent care called Your Caring Docs, which we'll talk about that later too. And then, so now I'm here just really informing people about what's going on in medicine, what goes on in their bodies, and also taking care of patients in the ER and through my telemedicine business. So thank you for having me.
Absolutely. So, Dr. Beckford,
Mm-hmm.
let's start at the beginning. You're from Jamaica.
Yes.
I know, because my family's the Caribbean as well, the
Mm-hmm.
pressures of being a child with a family from the Caribbean, the pressures of you must do better, do not embarrass me, do not shame me, you must do better. I'm working hard for you to do better.
Mm-hmm.
Um, Growing up in Jamaica, then coming to New Jersey, which is a culture shock, a culture change, but luckily it's a melting pot where you were.
Mm-hmm.
What made you go into medicine? What was the thing that said, this is what I want to do?
Well, you have hit a couple points. Coming from the Caribbean, at the time I was the only child, so it's all doting on, me. My interest in science was pretty high. I was, inquisitive, yet a shy person also. During the summer months, there were questions as what should you do because you no longer have school. Like we said, from the Caribbean, education is ranked very high in our household. So with that, I was, introduced to summer programs. So during those summer programs, the first one I actually did because I couldn't get into the medical program. So I actually did one at an engineering school. And I found that that wasn't really what I liked. And so I applied the next year, got into the one at the medical school. And ironically, through many summers, I did programs there. Initially, I thought I wanted to be a pharmacist. I got introduced to pharmacy, clinical pharmacy at the time, but they didn't know what to do with young high school students. I mean, I wasn't even in college. You know, in high school, you're a sophomore. Like, how much clinical skills do you have? So they placed me in the basement in order to sort out medical records in numerical order. Now, this is during the 90s, and we had only paper charts. So you can imagine me filing 13 numerical lists. You know how your medical record numbers are. They're never 5 digits. They're always 13. So I was like, I don't know if this is what I want.
Right.
So the year after, I applied again and I got interested. Let me try being with a doctor. And I was able to shadow a doctor. And with that, my eyes opened. I said, I really like this. I like the interacting with the patients. And I've often said that had I been introduced to a different part of pharmacy, maybe I would have been a pharmacist. You never know. But I got introduced to the doctor phase where I was able to interact with patients. And I said, that's what I want to do. So that's what narrowed me down. By this time, I was approximately 16 years old.
To be so young and to have a love of science and be interested in that. And of course, education is really highly ranked in many cultures, but because that's what we know, we grew up with it, how important it was. Like, go to the library and ask a question. Like, what do you mean go to the library, ask a question?
Absolutely.
Like, read a book.
If you ask a question, the answer is, well, did you look it up?
Did you look it up? Like, so we were taught to always research and always look things up and seek out your answers. And to be so young and to be a woman interested in what they now call STEM, I didn't know, to have that and to be encouraged is amazing. And to be in the 90s trying to do any kind of record keeping, bless your heart, because I'm not a fan of technology, but I love technology now, because doing, like you said, just filing anything in the 90s, paper, and then you realize how things get messed up and misplaced, and frustration happens. So you decided at 16 what you wanted to do, because pharmacy is not, if being a pharmacist is not easy as well. That's a lot that goes into that. So you decided to take on the journey, which is many years of school, to become a doctor of medicine. And you have treated everything. I mean, if you were working in Philadelphia and New Jersey, of course, you've seen it all. And you start off at the bottom. You start off in an emergency room, and you take care of the awful stuff, the ugly stuff, to kind of get yourself, allocated to what's going on. So what brought you to Texas? What brought you to the warmer area? What brought you down here?
So during my training period, Texas had some snow. Philadelphia, pardon me, had some snowstorms. So this is in the 08, 09. I distinctly remember and I have to preface this by saying, when you are an ER doc or anyone in the emergency field, you have to be there. You have to reach your job. That's what when an emergency strikes, that's your calling. That's when you
have to be there.
Absolutely. So during that time, I had some snowstorms, at least like almost 2 feet of snow, or if not a little bit more. So the day that I really decided, like, okay, I'm done with this, was when we had a snowstorm. Let's put it like, say we had a snowstorm on Sunday night, and the city cleaned it up by Monday, and they were so proud. Like, yes, we did it, and it was great. And I'm like, good, maybe it'll make it to work. By Tuesday night, we had another 2 feet. And I said, oh no. So when you've heard that adage, from the grandparents who grew up here or in
I walked through snow to get
a mile. I literally walked a mile to the train station because the buses weren't running. couldn't get my car out of the garage. So I had to, and I went skiing. Well, I should call it ski falling because I didn't ski prior, like a year prior. So I still had the snowsuit. So I literally had to put that snowsuit on and walk a mile with my bag because I wasn't going to leave the hospital the next night. That, after my shift, there were no transportations, and to that train station. And I said, "Oh no, I can't do this no anymore."
Time
So
to
I
go
said,
south.
I need to head south. And so when training was over, I looked for a job south in Texas.
Well,
So
you're in the right area. We have the medical center out here in Houston
mhm,
area. So you're in the right area. So it's safe
absolutely.
to say, with your training, and
Mhm,
I'm not, of course, I'm a liberal arts major. I'm a librarian by day. So I am not in the medical field, but I know so many in the medical field. And from what I understand, that ER training
mhm,
gives you a look of everything. Like you said, you have delivered babies, you've mended bones, you treated gunshot wounds, you've seen stroke, you've seen heart,
mhm,
you've seen everything, because we all have to come through there. That's the
correct.
canal to then branch off. So you have to have knowledge in so many areas about the body, about men, women, children. And
Mhm,
so, and living where you were living and training, of course, you're going to get the grunt work, you're going to get everything. And so it prepares you for a calmer life, a simpler life. Then you're walking through snowstorms, a mile. Like, you can tell people, I walked a mile in a snowstorm. Okay. I
literally.
walked a mile. Absolutely. So you come here, you're thinking it's going to be sunny skies and no snowstorms. We'll get into how that last 2 weeks ago changed your mind on that whole scenario. So, thank you for being on the front lines and being in medical field, because like you said, no matter what, you have to be at work. And we
Absolutely.
realize that more than anything in 2020, when you think of frontline workers, you think of maybe police and fire,
Mhm,
or you don't really think sometimes of the medical staff, the nurses, the doctors who have to be there and to be able to take on the flow
mhm,
of the sick that was coming. At one point, you didn't know what was happening. Like
mhm,
2019, we didn't know what was happening at the end of it. Then 2020 hit, and it's like, wait a minute, and it didn't matter where you live, it's a
mhm.
problem. So,
Absolutely.
with all your years of training, how did you remain calm? How did you
Mhm.
remain motivated and also having to live your life? Because I want to ask you, how were you in 2020 personally? How did you take care of yourself and your wellness personally, you,
Mhm.
your family, and then have to then take care of all of us who ain't listening to medical advice and just doing what we want to do?
That's a great question with so many levels. So I'll start off with 2020. Let's hit it up with March because prior to March, we heard that something was coming.
Right, the rumblings was
There was
there.
a rumbling of
Mhm.
prior to the storm. So when I knew that things were really getting pretty intense, right prior to the lockdown, is when we were getting a lot of information from the institution. And the information will come out, say, maybe like once every 2 weeks. And then it came out once a week, then once a day, then three, four times a day. And it was,
Yeah.
and then the information, the tone started to change, it became more serious. And then of course, once we really recognize the how bad COVID is and how it affects the individuals, and the fact that we did not have a grasp on it, then of course, like we said, things really got real. So, personally, I and a lot of my colleagues, we know we're on the front line, so we know we have to be there. There was a lot of anxiety. And I'm just being honest. I'm not going to sit here and just act like, oh, I just had everything under control.
Right. You're a human
No,
being. Life is happening to you.
absolutely.
Yes.
Absolutely. So anxiety is one of the first set of emotion that comes in. And anxiety for me, like a lot of times if I'm anxious, it doesn't necessarily mean like I'm pacing and up and down. I kind of learn how to control some of that inwardly. But anxiety because there's an unknown coming. I am at the front line of this unknown, and I have a family. So my anxiety was not as much for myself, but for the fear of bringing this unknown home to my family. I have two kids and a husband, and my kids at the time were 3 and 1. So you can
Oh.
imagine, absolutely. So you can imagine how it is. And the 1 year old, at that point, he was 1.5. So a few months, right? I guess a few weeks after his first birthday, he had a respiratory issues and he was in the
Mm.
hospital overnight. So now you're hearing that you're having this virus is coming that affects what the respiratory center. And you're like, okay, now I have to really ensure that I can protect my children. I mean, he just got here. You know what I mean? He has his
Yeah.
whole life ahead of him. I can't be the one to unknowingly, infect him with something because I'm reckless. So that allowed me to, one, keep thinking about how will I protect my family, not just from the stance of proper protection in the PPEs that we keep hearing about, but also how can I protect them financially if I'm gone? So that's when you start thinking about, yes, right? About putting your will together. And that those were some of the things that us as frontline workers started saying, like, okay, well, if this happens, I need to ensure that I have my will together. I need to ensure that I have, allotted all the finances in case I'm taken away, because I want to ensure that my family is taken care of in my absence, such as if I die. So that brought, of course, on a lot of anxiety. And then the anxiety also paired up with the fact that you had to try to remain as calm as possible for your patients, right? Now, that is the juxtaposition, because if your doctor comes in, and it's not that we're trying to placate our patients, I would, love to ensure that we understand that that's not it. But if we are coming in anxious and you are also anxious, then how
Mhm.
are we going to provide great care for you, right?
And that's
So
so
you have
hard. That's so, so difficult.
absolutely. So you had to have a logical way of thinking about things. You have to try to come up with, and that's when algorithms start coming in, right? So you have the algorithms so that you can follow your algorithms from the clinical standpoint to the best of your ability for what the research shows at that time, so that you can be there emotionally for the patients, for their anxiety, right? So that you can calm them down. So you had to be able to do two things at once. You have to be present for these patients who are nervous, they're anxious, or those who are extremely sick. And then from the medical standpoint, you do your algorithms, you take care of everything from the medical standpoint, but you pair them together to try to provide the best care. So
Do you
those
think
are some.
though, because that sounds great, right?
Yeah.
But listen, I'm
Hmm.
sick, I'm freaking out,
Hmm.
and you're way too calm for me. I need you to freak out with me. And I think
Hmm.
we forget as patients,
Hmm.
our medical professionals are humans as well, and they're also battling.
Hmm.
And we're demanding, humans are selfish, right? We think of ourselves first initially.
Hmm.
You have to teach yourself to not think only of self first. It's like, oh, what will
Hmm.
I do? How am
Hmm.
I doing? And you
Hmm.
should think about yourself and your self care, especially
Hmm.
during, COVID. You have to, because if you're not mentally there, you're not able to do the jobs that you have to do.
Absolutely.
You cannot do that because you're coming in. I may have COVID and look fine, no symptoms really, and someone else next to me is on needs a breathing assistance,
Hmm.
having organ failure, all so it's such a different environment each room you walk into. And
Absolutely.
to listening to your process, to have to think about those things, we forget as patients that you're human and
Hmm.
you're trying to keep yourself calm as well. And
Hmm.
you're trying not to bring home to your family anything because your family is so brand new and so young. And for you to say, thinking about wills, you're thinking about all these things because
Hmm.
at any point in time, your life can change
Absolutely.
and you're not there. And we don't think about that as patients. We don't think about that that you're a human being, you have a life, you have a family, and for you to say, well, we're getting our wills put together because I'm in the library. I'm not thinking about getting my will together because of who I'm in contact with. And that's a different mindset. It's a totally different mindset. So clearly I understand how your 2020 has been. So let me ask you, what was your biggest frustration? Let's have an honest conversation. What was your biggest frustration dealing with the cases that kept coming now, not once a week or once a day, every minute, it's a different thing. What was your biggest frustration with everything?
I'll say the biggest frustration lied with not just the surge that would occur. It was, you knew a surge was coming because you had a holiday period, right? So once you had a holiday period, you knew at least 2 weeks or a week or so later, you had this huge surge. Now, when the surge arrives, the frustration that lies with that is that you wonder if some of it could have been prevented, number one. And number two, you really see like the patients on the outside who are not as sick with COVID don't get to see when that surge arises, where we have patients in the hallway when prior to this, everyone had their own bed. Everyone had their own room. It's not that it's quote unquote comfortable because it's the emergency room. But the you have somewhere to plug your cell phone in to charge and scroll on TikTok and Instagram. But now everyone is so sick. And rest assured, in the facilities where I work, we separated the COVID patients. We're in a completely separate area than the non-COVID patients. But I mean, it got to the point where you had to put chairs around and people were hallway beds. Then hallway beds turn into hallway chairs and beds. Now, how often are you seeing hallway chairs and hallway beds? And this was happening because the rooms were filled, and then the hospital became filled. And when the hospital filled, the sicker patients, you had to provide the care that you can. Those who weren't as sick from the clinical standpoint were still feeling crappy.
Yeah.
And so they still came there. So the frustration lied in the volume, and also when you see so many sick patients, it affects you.
Yeah.
I can tell you that I, as an ER doc, I see a lot of the patients at the beginning, right? So I'm boom, 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 clinically, trying to get the diagnosis. These are what I think's going on. Let me start my interventions here, and then I'll pass you along to the inpatient team and so on. So I, was even informed by some of the administrators about some of the other inpatient teams that the respiratory therapists, they were, some of them became overwhelmed because this is a respiratory disease, and patients were upstairs dying, like 2, 3 patients dying a day. And when these patients are dying, a lot of them were already on ventilators. So they already had the tube down their throat. So when that happens, when you're going to die, a person that's at the bedside is a respiratory therapist. So the respiratory therapist and some of the nurses and the physicians, you just kept seeing death upon death. Now we see death and, we are trained to deal with it. But this was, and the way that I explain it, it's kind of similar to you being placed in almost like a military type of environment where you're seeing continuous mass casualty when you're trained to deal with the casualty 1 or 2 at a time. You're trained to see, you might have a 1 or so patient die once, maybe every 2 weeks, or if in the ER, you might have a cold that comes in that passes. But when you're having 5 of your patients die that day, or 2 patients die the next day, and then 1 patient, and it's all, you've given it all you've got. So it's not
Yeah.
that
It's
you're being,
exhausting.
yes, it is
Yeah.
exhausting
It
mentally.
breaks your morale. It makes you question why am I even doing this? It makes you question, why did I get into this field if
Or
I'm not
am I
even
good
able to
enough?
help anyone? Am I
Yes.
not good enough? Am I able? And
Mm-hmm.
mentally, the toll is taking. Yes, you are not connected to that person via family or whatever, but
Mm-hmm.
you've
This is
lost
a life.
one and one and one. So it's like a toll where
Mm-hmm.
I've lost one, but you have literally had to sit by and watch
Mm-hmm.
hundreds. And
Correct.
then how do you not take that home with you? How do you not? So then you have to worry about staying connected to where you're still doing safety protocols on yourself
Mm-hmm.
and
Correct.
making sure you detach in some way to where you're remaining healthy, because you
Mm-hmm.
have to then go home, try to get some rest and not get anyone sick.
Correct.
So if I
Yeah,
can't save them here, I gotta save them here. That's a double whammy.
it is
That's
a
a
double
double whammy.
whammy. It is. And you're asking how did we try to have some type of sanity and to keep
Yes.
yourself throughout this pandemic. And I must say that it has been through social media, ironically, that I've connected with people who are either going through similar processes and also people who are like-minded in other ventures that I look into. So networking has been one of the great ways that has kept me motivated throughout this pandemic. And I'll say that prior to this, I was not as versed as going out and meeting new people, right?
Mhm.
That's just not my personality. I have my clique, and your
That's it.
circle
You're
is very
good.
small, and that's it because you're
Yeah.
comfortable,
Yeah.
But then now you can't physically go out, so you're meeting people through things like this, like the podcasting,
Mhm.
and and then now you're like, there's so many interesting people out there that are all over, and so you get to have something to look forward to take your mind off of that
It's a good
situation
distraction. You don't want to talk about
completely.
it anymore. You don't want to talk about work. You don't want to. You want to have a nice distraction, because
Yes,
that's your self care. That's how you take care
that
of
has
yourself.
been my self-care.
Meet new
Yes.
people. Talk about things that's not work related, and
Mm-hmm.
make those connections. Because I feel, for me, with everything that happened in 2020, we found new ways to connect. We had to
Yes.
find new ways to connect, and
Mm-hmm.
many of us formed great relationships and connections, um, because we all have this one similar thread. COVID-19 is a similar
COVID-19
thread. We've
all
all
over the
been hit
world.
all over the world, and we've all been
Yes.
hit separately in some kind of different way. Either you lost someone, or you know
Mm-hmm.
someone who's lost someone. Um, you may have thought you was an introvert, and you're not. You want to see people. You want to talk to people, and
Yes.
that, I think definitely you have to take care of yourself and your wellness. So let me ask you, in the midst of all of this,
Mm-hmm.
you have your own business. You have your caring docs. It's a telemedicine urgent care. When
Correct.
did you start that? How
Mm-hmm.
was that for you during COVID?
Okay. So COVID actually accelerated me starting your caring dogs. So I've thought about starting a business, and I, said, well, what is it that I like to do? And I like taking care of patients. I love medicine. And so I thought about starting a business. And then I said, well, if I like taking care of patients, then, why not do something in the medical field? Now, most ER doctors, we don't usually, have our own practices because you're trained to usually work in a hospital. So if you're usually working for a hospital or an organization that employs you to that hospital. There's some, but very few physicians, ER physicians, who own a practice, maybe a physician-owned practice. So with that, I said, well, I can do the telemedicine urgent care. With COVID coming in, it kind of accelerated that. So 2020 was really my year of learning and how to build this practice. I'm learning the intricacies such as getting the platform ready, getting the malpractice, all the intricacies of a business that some people, might not think about. You're like, okay, I'll open a business, and then also, like I said, networking, meeting with other physicians who they also start practices or they want to do something in addition to practicing medicine. So I launched on Thanksgiving of 2020. So, yes, and it's been going well so far. I've taken care of some patients. I've taken care of some COVID patients, patients who are non-COVID. And the beauty of the telemedicine is that I really get to take care of the patients the way that I want to. So my personality is there, my care is there. And then I realized that this is actually something that I've been doing all along. And when we say doing, I mean like the telemedicine. You have someone who calls you up, a family member who says, hey, this is going on, or my friend has this going on, and you're providing that care. So this now just allows me to provide that same care, but also just document it and, electronically send these patients medication if they need to. And it's all from the comfort of their home, which is what I love. So you don't have to end up getting up and leaving your house if you're not feeling well. You can just jump online, like you're saying, on this website, and then you book your appointment.
Right.
So it's convenient. And the part that I really love about the my Your Care and Docs business is that when I thought and conceptualized it, I really conceptualized it with our patients in mind who do not have insurance, which I know there's going to be a lot of patients throughout this COVID period. Your job might have put you on furlough, or you might have just lost your job. Maybe that industry is just no longer needed because things are shifting. Or, you're a business owner and you had to provide self-insurance, but maybe you didn't have the insurance at the time, but yet still things happen, right? You still get some of these symptoms, like you said, the URI, you still get your sinusitis, your mild asthma.
Yeah,
Now,
life is still happening.
life is
Life is
still
still happening.
happening irrespective of that. So with the Your Care and Docs, when I thought about my concept, I said, I want to be able to help these patients to not, especially some of those who are business owners and you're barely making that profit that month. I can take care of these for a flat fee. If your prescription is under the $5 list on some of these major uh, well, some of them are the pharmacies and some of these major stores, then your whole visit can end up being less than $100. That's
Right.
your visit and your prescription and so on. So with that in mind, I said, well, I can provide the care. You're still getting me. I still have all my education, irrespective if you see me in the ER or if you see me through telemedicine. It's still me, you know?
Right.
So I can provide this care for the community, for people at an economical cost, but still getting excellent care. And, those are some of my passions into starting the Your Care and Docs and starting my telemedicine business.
So let me ask you, has this been a form of um self-care for you? Because
Absolutely.
yeah, because this is, I mean, with
Absolutely.
COVID, like you were just saying, the pressure that you go through
Mhm,
trying to save lives, people are dying. You're hearing about it. Even if it wasn't you by the bedside, your colleague has to deal with it. So then you have to deal with
mhm,
their pressure and their stress and trying to, okay, let me remain professional. I have someone else. Let me see if I can help someone else. And
mhm.
this is the way, well, lately with COVID, you couldn't get into the doctor. So we're kind of all used to telemedicine now, right? Because of COVID. And so many non-emergency things were pushed aside. So many
Absolutely.
people were just told you can't get in, you can't see your doctor, or the appointments were just so far out. It's like by the time I get treated, my leg gonna fall off. I don't know.
Mhm,
So this is
mhm.
to me, hearing you speak of this, a different tone of when you're in the emergency room, you're still able to help people. You're still
Absolutely.
able to serve people, like you're self-employed, it's a flat rate. It's not going to break the bank and we can take care of you. If you
Mhm,
can't get into your doctors because of what's going on, we're going to take care of you. You're going to see me, my face. I'm the actually person that you see on the website. You'll be talking to them. So how fulfilling has this been for you? Even though you just started in less than a year, how fulfilling and how busy have you been with your business?
Well, we're still growing, so that's good. Fulfillment is at a maximum. It is at a maximum. I mean, I had a patient who she was unable, she was uninsured, and
Mhm.
she was unable to see a provider. And two things occurred. So she was having her discomfort, and her dog ate her medication, 2 weeks worth of her last dose. And this is a medicine that she needs to take. It's not it wasn't a pain medication or anything of that sort. This is a medicine that she needs. And she came home from work, and the dog's sitting there with a pill bottle, just flicking it down. Like, okay, well, I didn't eat your meds. So I was able to do a telemedicine visit for her. And we jumped online, and our visits was approximately like 15 minutes, which is usually how long it really takes. And the pharmacy was closing in, say, approximately like 20 minutes after our visit ended. And so I told her, well, she told me the pharmacy that she wanted to use. So I said, well, maybe you'll have to get your prescription tomorrow. I'm going to try my best to get it into the pharmacy tonight. But there's a possibility you might, need to pick it up in the morning. So I gave her some alternatives to do in the meantime. So I called the pharmacy because I had the time, and the pharmacist says, "Oh yeah, if she comes right now, we can get her medication because we're closing in 50 minutes. I can fill all this really quickly." And so as soon as I got off the phone with the pharmacist, I called her back and I said, "Oh, by the way, the pharmacy says to come now." And she's like, "Are you serious?" I said, "Yeah." He says, "Come right now. If you can get there within the next 10 minutes, you can get your prescription tonight and you don't have to wait
Nice.
until tomorrow." So she was just so overjoyed, by that ability. Now, a lot of times I send the medications electronically. So if everything is really stacking up, it'll be sent electronically. But if I have time, I'll try to call in and get the prescription filled. So that's a way that I was able to provide care for her, and that, like you said, in turn provide fulfillment to know that I was able to help her. One, I helped her
Yeah.
save a lot of money because she's uninsured. Two, I saved her a lot of time. She was already feeling ill. She didn't have to leave home to go sit in a waiting room. It's COVID time, and during that time it was a surge, so she would have waited a long time. And then three, she got her prescriptions with, in her case, her pharmacist was ready to just get everything done.
That's a
And so,
blessing.
absolutely, in 20 minutes, she was good. So she's just, and phenomenal. She said, "I feel so great. You saved me so much, time and money. And this is what I want to, let our listeners know that if there's a possibility, that's really what I'm out here to do, to really save you time and to save you money and give additional care, great care in the interim."
And
So
I think I'm telling you, we appreciate it. And your website is um youarecaringdocs.com is very easy to maneuver. It's
mhm,
straightforward. You have your services provided. You can be a new patient, existing patient. You can see what's provided. You can try to book an appointment. It's extremely easy. You
mhm,
read some terms and make sure you agree to everything. You put your information in and go from there, and you'll be contacted and you'll get everything going. Um,
absolutely.
and you are the person, you are the person on the page. You are the person you'll be dealing with. And
Mhm,
it's a great way to add to yourself. If I'm not able to do it in the ER, I can do it here.
absolutely.
Those small miracles, those itty bitty steps that we take
Mhm,
to, help people. And you
mhm.
also have, um, we can find you on LinkedIn, we can find you on Instagram and Facebook, all
Yes,
those great places. How
yes.
has it been for you, promoting yourself? Because you said you're not
Mhm,
really, 2020 made you more talkative, made you
mhm. Oh
more
yeah.
interactive,
Mhm,
and most doctors have a great bedside manner, some do not. 2020 can be, breaking down morale, breaking down your spirit. How has
mhm.
it been for you to put yourself out there to say, I'm going to do this? Personally, I'm going to do this.
Well, at first, of course, you're fearful. Will they like me? Or the biggest fear, I must say, is that when you stepped upon it or stumbled upon it earlier, when it's like, well, am I an introvert or am I an extrovert, right? So I am an introvert. I'm a very private person.
Mhm.
So when you are doing a business, you have to step out and you have to let people know that you exist. So you can't build a business and then sit and wait for people if they don't know that
Right.
you exist. So one of the challenges was really getting out there. And then one of my other passions is that I really like to educate patients, right? So that's when you'll see those videos that are going on now where so I decided I joined a group of us, I said, like-minded people, and we are in a group where we're motivating each other, and then we have a business coach, and she's like, if people need to know who you are, so go out
Yeah.
and let people know who you are. So I love providing education, so I said, okay, well, let me do this talk on Fridays. So that's when I started doing our Facebook Live
Mhm.
on 6:30 on Fridays. And I said, well, I started thinking about things that I saw in the emergency room, things that I took care of in the telemedicine urgent care. And I said, let me educate patients about what's going on in their body. Because if they know what's going on, then they can make great decisions. So you'll
Right.
know, and like, an ounce of prevention, right, is better than a pound of cure. So
Yes. Yes.
and then, in addition to that, if you know what's going on when you have gotten to that point, or a family member is going through a horrible medical condition, then you're more empathetic, right? And I mean,
Right.
sometimes that's all they need is a listening ear. So
Mhm.
I decided that I'm going to provide this in addition to just providing the telemedicine urgent care, and I'll provide information. So information on general medical topics so people know what's going on in their body. And that's where the birth of the Facebook Live. And then from that, I turned it into a podcast, a Your Caring Docs podcast, where you can,
Oh, nice.
yes. So I launched the podcast portion, I'd say maybe 3 weeks ago. So it's all still Your Caring Docs. So it's general medical information. For example, when we're talking about us, I came to Texas to get away from the snow. Mm.
We had a major ice storm in February where everyone's vehicles frozen to the. I mean, we don't fare well with that. We're not used to that. We may get
Absolutely.
snow every 20 years, 10 years, and doesn't even stick when it
Yes.
lands. But we
Yes.
had a legit snowstorm
Storm.
where we were 16 degrees,
Wind
pipe
chill factor of
burst.
0.
Yes, like frozen. We had
Ice.
snow that stayed on our roofs for days, ice on
Mm-hmm.
the ground for days, and you're like, I left New Jersey and Philadelphia. I did
And
not.
you're
I did not sign up for this.
absolutely. It was crazy. So it was crazy from that aspect. And then from
Mhm.
the medical aspect, as we mentioned, it's Texas. If there's any way to keep you cool in the summertime, everyone's got it, right? But
Yeah.
now to keep you warm in the winter time, that's where the issue arises. So as an ER doc, I started seeing a lot of carbon monoxide poisonings going on.
Yes. Yeah.
Yes. So, my platform is not only to treat our patients through my telemedicine, but also to inform them about what's going on. So that's when I use the platform to inform patients about carbon monoxide poisoning, like how it occurs and, why it's so dangerous. You're not going to see it, smell it, or taste it. It's not going to irritate you. And, what are some of the common reasons why people are getting carbon monoxide poisoning. So I did a podcast on that one. I, did the Facebook Live to just kind of educate our people about that. We had, pardon me, we also had our what boil water notice. And
Oh, we went
yeah,
through it all.
you
Doc, we
went
went
through
through
it.
it
This
all.
is And we will say, in addition to that, we provided information on boiled water notice, what it is, why we do it. And then the next week, it was 70 degrees.
Hot.
Sandals.
Hot. And then now, what is it today? Like 50?
15 degrees. Absolutely.
Texas is trying to kill us. Texas is trying to kill us, okay? That's all I have. Texas is trying to kill us. Let me ask you. So right now, this will come out a little bit later, but in the present, we're both in Texas, in the same Houston area, general area. Your practice and what you do, you're in Cypress, which is still like Houston. So you're right here, what's going on. So our governor announced that he is raising the mandate to wear a mask. He's allowing businesses to, do what you feel. If you want people to wear a mask in your business, that's fine. But you can go back, you can go now to regular capacity in your business. If you want people to wear masks, it's up to you. But I'm just telling you right now, I'm raising the mask mandate, and you can go back to 100% capacity in your business. What is your fear with that? How do you feel about that? Because we're going into spring break right now for us. Easter's coming up, another holiday. We're actually a year from when we shut down. How does it feel for you? All the hard, and I'm not trying to sway your answer, but all the hard work you and your colleagues have put in this year, from nurses, doctors, from cleaning people in the hospital, custodial staff in the hospital, all of those people. How does it feel when your anxiety gets high for a regular holiday? It's like, oh, here comes Easter. Oh, here comes Thanksgiving. Lord, here comes Christmas. Here comes the New Year. So now we're open in Texas. As of next week, on March 10th, we're open. How do you feel about that?
I would say that I feel cautious. One is because of everything that you mentioned. I, do understand that there are a lot of businesses who lost a lot of money, who ended up closing because of the pandemic. And, some of these decisions might be financially related. However, from the medical standpoint, I was hoping that we would have waited until we had a lot more of the population vaccinated before we went ahead and opened it, to say that you're free to do, mask, whether you want to or not is up to you, versus trying to mandate people. So I think me, and I think a lot of my colleagues, we were hoping that maybe mid-April would have been the time when this would occur, because it would have allowed a lot more, especially we've now amped up the mass vaccination process, right? Before, it was still challenging. Like, people wanted, a lot of times you hear about people don't want to get vaccine, and you hear about that, but people want to get vaccinated, and they're looking left and right and say, well, how can I get this vaccine? And they weren't able to. So with us finally getting things a little bit better, or it must much more improved. I'm not going to say under control, but much more improved with the vaccination to the masses. I was hoping that we would have gotten a chance to provide more vaccines to the patient population through that period, and then afterwards, like I said, like around mid-April, we would have said, now we'd be in a position to say, okay, now it's time to live, now that we've had this percentage of the population is vaccinated, and therefore can provide herd immunity to those who are not vaccinated at this time. And with that, I was saying, oh, we're going to have a great summer. Now, I'll be honest, I'm worried about the summer.
Yeah, I mean, it's a legit worry, because you work in it, you see
Absolutely. Yes.
And it's a legitimate worry. And I think there's mixed emotions, and I understand feelings on all sides of it.
Correct.
But I also think I'm trying not to be a burden. My biggest thing is, what can I do to not be a burden? My biggest thing is if all I have to do is this, then I'm going to do that because I don't want to go to the hospital. I don't
Right.
want to have to deal with thinking, how will my symptoms be? How will I react to it? Because everyone is
Mhm.
different.
That's the
And
challenge
knowing
also.
that's the biggest
Mhm,
challenge, and knowing that space is limited, and then putting that fear and that worry on my family
mhm,
because, I didn't do my part, my simple part to, and I'm not taking away from anyone who thinks differently. I just think on it's a moment to not be selfish. That's just me.
mhm,
And I know I'm still gonna wear my mask. No matter what, vaccinated or
mhm,
not, I'm still gonna wear my mask
mhm.
because I'm not trying to see you in the hospital. I'll come see you for lunch. I'm not trying to come see
Right?
you uh, in a hospital bed thinking, Lord, not today. You know what I mean?
Correct.
But let me ask you
Mhm,
something. It's Women's History Month,
mhm,
and you are a medical doctor. You are a Black woman from the Caribbean. You're a doctor.
mhm,
I want to ask you really quickly, how has it been for you being a woman, knowing the difficulties that we face as Black women getting medical care and being heard?
mhm.
How much of that kind of like push you more into this field? And how do you feel about being like a pioneer and someone that can, when you walk into the room and someone looks like you, say, hey, I got you? How does that feel?
Okay, so on a couple levels, so with being a Black woman and getting into medicine, we do recognize that it is challenging. And I can say that I've had a lot of champions along the way. When you mentioned the STEM program, or, so I've had some champions who have helped to push me during my formative portion. And so that's why I'm here at this point. There was, Mr. Lonnie Wright. He was in Office of the Minority Students at the University of Medicine and Dentistry, which is where I went to med school at New Jersey Med School. And from prior to me even started med school, he's been a champion. He's helped thousands of us to become doctors by advocating for us and by letting us know these are what you need to do in order to be a great candidate. And then when you did become a great candidate, he advocated to get you in through the door, right? So that helps a lot. Now, from a women's standpoint, being a woman in medicine is challenging. And I'm not going to make it seem like it's not, because we have society that there's still the traditional male and female roles that are thought upon in society, right? So you are doing what was prior considered. I mean, if we're thinking about in the early 1900s, there weren't a lot of female doctors, right?
Right.
So you are doing what still, even though it might seem as if there's equality, it's still not. Let's just be honest, because there's still that stigma that once you finish doing what you're doing at work, you still need to do all the mothering and all the nurturing and also be, part of the family at home. Not that you don't want to do it. You, of course you do, but you're also doing that with the stigma of I'm a mother, I'm leaving my child, and I'm going out to take care of others. And when you hear the I don't want you to go to work, that happens to everyone, right?
Mhm.
So you still have to explain to your children like, hey, mommy's a doctor, she takes care of sick people. So, they understand what's going on. So it's challenging. The mom guilt is there, and you have a mom guilt on top of the fact that you're a physician and you have to
Yeah.
snap out of it and get there. So now let's talk about when you're at work and being a Black female physician. It's always an honor and a privilege to take care of all my patients. But I understand what happens within the community, especially with underrepresented people not feeling like they're being heard through healthcare. So I ensure that when I am in that room, that you feel heard. Yeah, it's interesting. When I was starting the telemedicine business, I put out a question to a group, and I asked if, are you interested in telemedicine? what is it that you like and what is it that you do not like. Now, one person, she wrote, and I'll never forget, and this is something that's pushing me forward. She said, I when I go to the doctor, I don't feel like they listen to me at all. And I am just concerned that it'll be worse when it's through telemedicine because you're not even physically there.
Yeah.
And I explained to her, of course, that I apologize for the fact that she's had such bad encounters prior, but her statement to me sticks in my mind to ensure that I make sure you and my fellow colleagues know that you need to be heard, that there isn't going to be a stigma like, oh, she's just acting up, she's not really in pain. No, she's in pain. Oh, the sickle cell patient, they're just drug seekers. No, sickle cell disease is real. If you
Yeah.
had your blood turning into a sickle, which is basically like a hook and scraping along your blood vessels and then clotting things off, you will be in pain also. you
Yeah.
know so it's
Yeah.
important to educate our colleagues, and it's also important that our patients understand that we know and we are listening to you. So I do my best. I am extra vigilant. I check my biases. I check it.
Yeah.
And when I step in, if someone comes to me prior to me going into the room and start telling me about this, I lock them out. I want my encounter to be fresh. I don't want any pre-existing bias. I want, my encounter with you is that encounter. If you're rude to me at that time, then, we figure it out. Like, well, what's going on? Why is it
Yeah.
that you're feeling this way? Explain to
Hmm.
me. A lot of times there's a barrier up that we talk about, right? The barrier
Hmm.
is up with those of us in the minority, or especially let's talk about the black female barrier, because you already
Hmm.
feel like I stepped in and nobody's going to listen to me. When that barrier is
Right.
up, I
Right.
try to break it down. Well, no, tell me, why is it that you're so frustrated? And
Right.
then by the end, we tease out where the frustration lies. And then I try to figure out, are there resources that I can use to help you? So, after you leave here, are there additional things that I can provide for you so that the care just doesn't end here? So those are the things that I personally do for my patients in order to try to bring as close to equal care for everyone as I can.
Well, I want to say, Dr. Beckford, thank you so very much for coming on the show.
Mhm,
I really felt it was informative, important. I admire what you're doing. I love what you're doing. I love your purpose and your mission. And I want to say thank you for taking care of us before COVID and during COVID. And I
my
hope
pleasure.
that even though we're opened up, that is the stress doesn't amplify for you with everything going on. And I
Mhm.
wish you the greatest success. And I'll make sure that everyone knows who you are and to call and go to your website. So before I let you go, please let everyone know where to find your website, where to
Mhm.
find your podcast, and where to find you.
Absolutely. So I am on Your Caring Docs on all platforms. So that's for the website. It's www.urcaringdocs.com. And for the podcast, it's the same, Your Caring Docs, URCARINGDOCS. For Instagram, similar, Your Caring Docs, URCARINGDOCS, and also for our YouTube, Facebook. Facebook, it's the same, Your Caring Docs. We have a Facebook business page where I said every Friday at 6:30 p.m. Central Time, we provide general medical information information about general medical topics, I should say, that everyone should know about themselves and their body. And it's a way for us to just get educated about what's going on in our bodies that'll help us to make great decisions later on in our medical care. And the podcast drops every Monday at 5 a.m. It's available on Spotify, on Google, like YouTube also, and we are also will be on Apple also. So I hope you guys, yes, will enjoy all this great info that I try to provide.
Oh my, and please know you are welcome on the show anytime you want to talk about
Oh,
anything. You are welcome. You're a part of my podcast family. You're
oh,
welcome
thank
to be on the
you.
show. I'll make sure that all of the information is as well going to be in the show description. And I want to say, everyone, please make sure you follow her podcast, log on to her website, go to Facebook for the same. You are caring docs
Hmm.
on Facebook as well and Instagram. And make sure you follow this show, Shall You Proceed, on all major streaming platforms and YouTube. Thank you so much, Dr. Beckford. I appreciate you. I honor you, and I wish you the most utmost respect and success. And I hopefully we do not have any spikes, so you can maintain your peace.
Thank
Because
you.
I'm not trying to see you in the ER. Okay, I'm not trying to
Nope.
see you. I'm not trying to call you for anything. But hey, you want some lunch? Not, hey,
Absolutely.
I'm sick. Thank you so much. Okay.
All right. Thank you for having me.